All right, so we have two or three questions that patients have posed and we're looking for an answer to. The first one is, are there really different breast shapes and what factors do they play in regards to outcome regarding breast surgery? Well, of course, there are different shaped breasts. You have some women whose breasts naturally have a good round shape. They have nice upper pole fullness. Their nipple areola position is great on the breast mound. And so a simple augmentation alone will give them a fantastic result. It's almost impossible to, if you will, have a bad outcome there. You can tweak the outcome by changing the size or the shape of the implant, the profile of the implant. Women who have a pointy breast, though, and bring in a photograph of a round breast with an excellent position nipple areola complex or an areola that's smaller than what theirs might be, presents a whole different challenge. Often enough, you'll have to reduce the size of the areola, or you may have to raise the nipple areola or do a breast lift. And then in order to get some women fullness in the upper pole, we may do a lift and combine that with an augmentation or an implant or even autologous fat grafting where we go and get some fat from another location of the body and transfer it into the upper pole of the breast. So yes, breast shape or appearance plays a huge role in regards to outcome. The second is, are there remedies for stretch marks and cellulite? Not really. There's nothing that is out there that would say, Viola, the magic pill or the magic surgical procedure. And patients have a lot of stretch marks. Let's say, for example, in the lower tummy after having children, a tummy tuck will get rid of a lot of those stretch marks because simply you cut them out. And the ones that do remain are pulled tighter. And the stretch marks, to me, under tension, look better than stretch marks that are flaccid and loose. Stretch marks that are immature, meaning that they've just arisen within the past, say, 6 to 12 months. Often enough, they're red, and particularly on someone who's light complected, that redness, if you will, just kind of jumps at you. So you can use a pulse style laser and perhaps accelerate or get rid of the redness a little bit quicker. But again, nothing magical, particularly for those older white atretic ones other than direct excision. And then as far as cellulite, cellulite basically is where the fibrous attachment between the dermis of the skin and the underlying fascia is uneven. And so you'll have dimples and high spots. And a lot of people are under the misconception that liposuction is a good treatment for that. It's not. It may help. It may not change anything, but I don't think it would really worsen some situation. There was a laser device that was touted as going to be great, but what you found was tremendous expense to treat very small areas, and so it never really caught on. Endermology is a device that uses a suction type, very much like a shop vac or a vacuum cleaner, and it's got roller heads on either side, and it stretches those shortened septi, and so you can get a smooth appearance or diminished appearance in cellulite, but it's transient and temporary, and so when you quit doing endermology, then the cellulite returns. So if you're into pageants or you've got an event coming up, reunion and whatnot, then certainly could do it for the duration of that, and then either maintain it by continuing to do it, or if you quit, no big deal, it would return. And then the third was, what type of music do I listen to? Most of the time on Sirius Radio, I listen to classic vinyl. On Pandora, I like Steve Miller Band radio, and then I also like the Johnny Cash radio.